Moving on to our next topic, alcohol. In this section, we are going to talk about how you can get the good and avoid the not so good if you do choose to drink. There's a stereotype that all college students drink and drink a lot, but that is far from the case, especially here at UAB. There are some statistics that show just how different our students are. Of students who completed UAB's National College Health Assessment in fall 2024, 32% of students reported that they actually don't drink. 71% of students who do drink reported that they don't drink to get drunk, and 81% of students who drink consumed 4 or fewer drinks the last time they drank. If you do choose to drink, remember our method. Measure your drinks, eat protein before and during drinking, travel and stay with others, hydrate before and in between drinks, limit yourself to 1 drink per hour, and don't drive. Each of these protective factors can help ensure that you have the safest night possible. Let's talk more about how these can help. To measure alcohol, you need to know what a standard drink is. A standard drink is a serving size based on how much alcohol, or ABV, is in different kinds of drinks. Knowing how much alcohol is in a drink can help you regulate how much alcohol you're consuming. In general, a standard drink is 1.5 ounces of 80 proof liquor, 4 to 5 ounces of 12% wine or champagne, and 12 ounces of 5% alcohol. Beer. And so as you read in the previous slide, we recommend pacing yourself to 1 standard drink per hour, and we'll talk more about why that's important. But it's also important to know that not all drinks are standard, and that's why counting cups, cans, or bottles is not always accurate. We're taught to read nutrition labels on foods, but not always on alcohol, and that matters. For example, 1 wine carton that's pictured on the screen is 3 standard drinks, and that one is a little bit easier because it has it listed at the bottom for you, but some of these other ones are a little bit more difficult. So the PBR Extra is about 1.3 standard drinks. An 8-ounce Strawberita is 1 drink, and a Four Loko is 5.5 standard drinks. So just one can of Four Loko counts as high risk drinking. So reading those labels helps you understand exactly how much you're consuming. Mixed drinks are tricky because the alcohol content depends on what's used and who's mixing it, right? So sweet flavors make them easy to drink quickly, but just 1 Long Island iced tea can push an average person over the legal limit and count as high risk drinking. So this is even more important for communal drinks like Hunt Punch or Jungle Juice, since you can't calculate the alcohol and don't know what exactly was poured into it. Let's talk about BAC, or blood alcohol content. This is the amount of alcohol in a person's blood and helps us understand their level of intoxication. Everyone's BAC is affected differently by several factors. With sex assigned at birth, estrogen can slow alcohol breakdown, while testosterone may speed it up. Menstrual cycles, hormone therapy, and some birth controls can also affect BAC. With genetics, your body may naturally process alcohol faster or slower depending on enzyme production. Weight. The more body weight that you have or higher muscle mass can dilute alcohol, while body fat absorbs it a little bit differently. With the strength of your drink and your consumption rate, higher percentage drinks or harder drinks and drinking really fast can increase your BAC more quickly. And then lastly, with food intake, we want to make sure that we are eating before or while drinking, and that can help slow the alcohol absorption. What foods should we be eating before we drink? Many people think that eating carbs like pasta or bread will help when they're drinking, but that's not the case. Carbs digest really quickly, leaving your stomach empty, which means alcohol enters your blood a lot quicker. Protein and fiber-rich foods, on the other hand, stay in your stomach longer and slow alcohol absorption. Eating protein before and during drinking can help keep your BAC from spiking, making you feel better and reducing the risk of getting sick or nauseous. But it's really important to remember that eating after you drink won't reverse any impairment that you have. It's important that before you start drinking, you have already fueled up and have some food in your stomach. Next up, what is the point of diminishing returns? We tend to think that the more we drink, the more euphoric and happy we will feel, but that is actually not the case since our bodies can only handle so much alcohol. So the point of diminishing returns is exactly that, the point when one more drink kind of pushes you over that edge. So alcohol is considered biphasic, meaning that it has two phases. There's a point where our bodies stop experiencing the pleasant side effects and begin to experiencing those more negative things. And so that could be hangovers or fatigue or all of the things that are on the next slide. So let me go on to that one. So the first phase of the biphasic curve is while BAC is lower, the effects of alcohol may have a mild buzz or a pleasant high. The second phase, however, is when you have higher levels of alcohol concentration. The effects of alcohol become more negative, including, like I was mentioning, fatigue, physical impairment, and impaired judgment. This is an important time to talk more about binge drinking, which you may have heard me talk about previously. Binge drinking or high-risk drinking. And that is defined as having 4 to 5 standard drinks within a 2-hour period. When somebody is participating in this high-risk drinking, they are much more likely to fall into phase 2 of the biphasic curve and experience the not-so-good parts of drinking. The only thing that can truly help sober somebody up is time. On average, the body can process only about 1 standard drink per hour. People try to speed it up with coffee, cold showers, or energy drinks, but these can only make someone feel more awake. They don't actually reduce the alcohol in their system. Eating before or during drinking, like I mentioned, can help slow the alcohol absorption down, and staying hydrated can help reduce hangover symptoms later, but neither are going to sober somebody up instantly. The safest approach is to plan ahead, pace your drinks, and allow plenty of time before driving or doing anything that requires your full attention. Sometimes drinking too much alcohol can overwhelm the body, and time alone is not going to be enough. Alcohol poisoning is very serious. It can cause your breathing to slow or stop, the heart to beat irregularly, and gag reflex to shut off, which increases your risk of choking. So remember cups to spot those warning signs: cold skin, unresponsive, puking or slow breathing, and you may sometimes hear shallow breathing as well. Other warning signs could include confusion, vomiting while passed out, seizures, or bluish skin or lips. If any of these occur, call 911 immediately. Even if you're unsure, it's safer to get medical help than to wait and hope that they sleep it off. Alcohol poisoning can happen to anyone, and even if they're experienced drinkers. At this point, you've probably heard about our medical amnesty policy, and ultimately, we have that in place because we want our students to be able to get help. It is important that you call for help. So if somebody is showing those signs of alcohol poisoning, we want you to act quickly. Like I said, first, we want you to call 911, try to wake them up if possible, and stay with them. If they're unconscious but still breathing, place them in the recovery position. You can kind of see that in the picture there. So we want them on their left side, head tilted slightly back, in an attempt to keep their airway clean or clear and prevent choking. It's also important to be honest with emergency responders about what and how much they've drank. This can help them provide proper care. We want to make sure that you are not leaving them alone, trying to force them to drink water or take a cold shower. Some of these actions can make things much worse. If vomiting occurs, we want to make sure that their head is tilted to the side, like I said earlier, so that they don't choke. And ultimately, the main takeaway from this is never underestimate the danger of alcohol poisoning. The quicker you can intervene in this situation, the better. So just to recap, here is our method again. Measure drinks, eat protein, travel with others, hydrate, 1 drink per hour, and don't drive. If you or others are drinking alcohol, situations can arise that will call for you to be an active bystander. Being an active bystander is someone who chooses to do something to reduce risk of harm or to help someone in need. To be effective, there are specific techniques people can use so that the intervention works, does not put you or the other person in an unsafe situation, and does not escalate the situation any further. You can intervene directly by causing a distraction. Uh, wait, yeah, you can intervene directly, and that's in the moment with that person, directly about what's happening. You can distract by creating some kind of distraction and pulling people away from whatever situation is happening. And then you can also delegate the intervention to someone who may be more equipped to handle the situation. Two more interventions or strategies to intervening are document and delay. These won't always make sense, but they can be very useful for certain situations. You can document by recording or taking notes during an event. This one is important, for example, if somebody is extremely intoxicated and maybe you're concerned about their use. We're taking notes of those situations and combining that with delay, waiting until a later time to have that discussion, right? If somebody is really intoxicated, then if they're intoxicated, they may not receive that correctly, right? So we would delay until a later time till they were sober, and maybe open to that. Obviously, like I mentioned, there are other times where where delay does not work. So if somebody was experiencing alcohol poisoning, delay would absolutely not be the action we would want to take. So here's a scenario that you may encounter while out drinking. You notice that one of the players in a drinking game appears to be very intoxicated. They eventually say they want to stop playing, but other players urge them to keep playing. Think back to the 5 Ds we went over in the last slide. What would you do in this scenario? You can be direct with the person who is intoxicated by asking them to come with you somewhere else, or direct with the people pressuring them by asking them to stop. You could delegate to the host or another friend to intervene, or you could cause a distraction by spilling your drink on the table or getting the players to focus on something else. In this instance, document and delay may not work.